Hi, I'm Ray Scott, a volunteer at the Skywalk Cafe and surgical waiting at Cooper and Harrison. Covenant and SVSU have partnered together to create a one-of-its-kind program for patients, physicians, and pre-med students.
Covenant Healthcare and Saginaw Valley State University have started a unique alliance, placing SVSU students in the Emergency Care Center as real-time medical transcriptionists.
A lot of places report that as they go to electronic medical record, they see a decrease in their productivity. Now, we hadn't seen that. We kept dictating, which I think helped us quite a bit, but we knew over time we were going to have to do something different. Transcription is very expensive, and it's not immediately available.
Staff had tossed around the idea of physician facilitators, also known as scribes, in the ECC. Those ideas came to life last summer.
A good friend of mine was over for a barbecue, and we were sitting talking. He's a professor over at SVSU, and he said, hey, I've been looking at other class ideas, and I started talking about the Scribe program. He thought, well, this would be awesome. I could teach people, and then you guys could come over and use them as scribes. And so that's where it started, and we've kind of had this collaboration ever since.
Dybel's friend is SVSU kinesiology professor John Lowry.
What we're doing and the way we're doing it is different from the way other hospitals go about it. There are a lot of hospitals that are using scribes in the emergency department. Many of them hire private companies to come in, train scribes for a period of time, and then maybe provide some ongoing consultation and some services to support that. Ours is unique because we're the only university that I know of that it's not affiliated with a medical school that is offering the class. And also we have plans to do a lot of research related to the Scribe program.
The physician facilitators accompany a physician during a shift and capture data into an electronic medical record. While they have no direct patient contact, they are a great asset to patients, physicians, and the hospital.
As I'm going through and interviewing a patient, they've learned to pick out the important things. And they put it in a format like a doctor speaks. So there's a lot of training that goes into these scribes learning the terminology and learning how a doctor speaks. And there's a lot of on-the-job training even after they're hired. But once they're done, their charts are amazing. They're better than some of the resident charts sometimes. It used to be I would get done with my 8-hour shift and then I'd start dictating. Ideally you do as you go, but if there's patients to be seen, they're urgent, you gotta go see the patients. So by the end of your shift, you're left with 15, 20, 25 charts to do from memory. And now they're already mostly written by the scribes.
One of the advantages for physicians, according to Dybel, is that there is more patient time and less computer time. In turn, the patient acceptance rate of scribes is 97%.
I'm not trying to take notes frantically. I'm not trying to memorize everything they're saying. I'm just kind of listening and okay, that, good, good, good. And my scribe's taking care of all the documentation aspect of it.
Christina Brookshire was one of the first students who went through the medical scribe training course. She now runs the program for the scribes.
It gives us a chance to kind of really see what medicine is like. I mean, when you volunteer, you're cleaning or giving pillows or changing sheets, and this gives us a chance to really see what the doctors are doing, and they explain things, maybe not to us, but we get to hear it. We get to see procedures where you wouldn't get to when you're volunteering. And I mean, it's the first class that actually pertains to what we want to do.
Kinesiology 390 utilizes team-based learning, where students take quizzes and tests individually and as teams.
They're held accountable to each other for participating, for collaborating together, and everyone in the group gets the same score on these team quizzes. And so it encourages every member to be an active part of it. They have a lot of discussion outside of class. They really learn a lot from each other, which really makes my job a lot easier so that I'm not the one teaching it to them for the first time.
Other important tools used in the class are emergency department simulation videos, created in the Sim Lab at Synergy Medical.
We're able to show those videos in class to the students, and they actually practice scribing them in real time, just like they would in a real case. We pause them and we review them for accuracy, for completeness, and we give the students a lot of immediate feedback on how they're doing.
Currently, 14 scribes work in Covenant's ECC. 10 more are going through the class now and will be eligible for employment in April. With 80,000 patient visits to the ECC in 2011, scribes can vastly improve patient flow through the department.
it's our job to make sure that the scribes are ready to hit the ground running once they're hired. The students who will graduate from the class this year will be far better prepared than our first group was, simply because we've been able to learn from what we've done before. We've been able to enhance the class, and we have a lot of things that we're doing now that have come from what we've learned about in the past.
I would retake it again just to see how much it's evolved and what else you can learn, because what they're going through now is a little bit different than what I went through, and the experience that it gives me now in my job is the best thing that's happened in my undergrad.
Everybody I've talked to has agreed. If they had a chance to do this when they were pre-med, they would have jumped at this. These scribes, they're shoulder to shoulder with the doc. They're walking right into the room. They are there seeing the patient in whatever condition they're in or whatever needs to be done. And they're getting to see the real side of medicine.